My name is Arthur Squire. I'm now retired from my practice of pulmonary disease, internal medicine, and critical care medicine. I came to Baptist Hospital in the summer of 1975. When they moved into the hospital in, I think, was it 73 or 72 that this building was finished, 72, there weren't any drapes in it. And there was this big brouhaha about which union was involved in hanging the drapes. And they simply could not tackle it successfully. So our head nurse got all the nurses together, and the nurses went and got in the boxes and hung all the drapes in this place, and she was very proud of that. I had been aware of foreign nurses for a long time, because when I was in Chicago at my internship, we had a number of Filipino nurses there, and some Filipino doctors, which was also unusual. The big cities got the foreign folks first. We had wonderful nurses from Great Britain, from Scotland, from Ireland. Many of them are still here. And then we had a bunch from the Philippines. We were full. The intensive care units were full. They gave us the most wonderful people to help us. I still communicate on a fairly frequent basis with some of my respiratory, I say mine, they weren't my respiratory therapists. We were partners in taking care of these people. They were magnificent. You could count on them. They were bright. They knew limits. They helped the patients. When they came up with the all our best motto, it was true. Everyone gave their best, and everyone loved doing it. But you know, the lab people, the x-ray people, the technicians of one kind or another, all were gutting it out to try to do the best they possibly could for the patients. When I had a patient in the hospital, that was my patient. I came to the emergency room to see them when they came in. The ER doctor was there, and they might see them, but I would come see them too, because it was my responsibility to put them in. My wife started to fuss at me about it a little bit because I was gone a lot at night, but that was part of it. The administration of the hospital intended for this to be an excellent place, and I think they still intend for it to be an excellent place. And they did what they could, given the facilities, the monies, the time, the potential effort, to provide us the best possible place to take care of our patients. And that's what makes a success.